Hey everyone, what's up? Dr. Charlie Johnson, physical therapist here. If you are new to my channel, thank you so much for checking it out and showing interest. I'm a PT. I help people worldwide with unresolved back, butt, and sciatica problems essentially learn how to fix themselves using the power of the mind and movement as medicine. So in today's video, hopefully a short one here, I want to talk about the importance of measuring progress and having a way to do so. All right, so not the sexiest thing in the world, but super important, right? Like, would you ever get in a car and just start driving, right, without any way to check in, any waypoints, if you will, any stops along the way to make sure, a GPS, if you will, that you're headed in the right direction, right? And this is what people do, though, when they go and they get treatment to try to fix their pain or resolve their pain, right? Would you ever start a weight loss program without first stepping on the scale to see what you weigh? Probably not. Probably a better way to do it, right? You might think that was a little weird. And so how are you measuring progress? How do you know if what you're doing is working and or not working, right? And so I chatted with a guy the other day. He said, hey, I think I'm going to keep doing what I'm doing because I think it's working. If you have to think something is working, well, then chances are it's probably not working, right? I don't have to think that I woke up this morning. I don't have to think that I started my car on my way to the office. I don't have to think that when I hit the light switch, the light turned on or not. It's clear, right? There's some clear, measurable way to say, hey, I did this and this is what happened. Now, yes, pain is a little bit nebulous, all right? Pain is a little bit of subjective experience, if you will. But at the end of the day, if you don't measure something, you can't track progress, right? You can't manage what you don't measure. That is the big takeaway of the video, okay? So the question becomes is, how do you measure what's happening, right? Well, if you aren't taught how to assess your own body, then it's very difficult to track progress because you're the only one, these are some noisy geese, you're the only one who knows what you're truly feeling. So if you're saying, like, oh, I go to the chiropractor and they kind of check some things and they tell me if I'm getting better, right? That just makes you completely reliant upon them, and you hope and you trust that they know what they're doing, right? But what if you could measure progress a different way? You can. You can use movement and use self-assessment to identify motions that are yucky. I call these yucky motions, right? Such that you can, if they are clearly reproducible, this is important, you can only use movement to assess whether or not you're improving or not improving, if there's some clearly reproducible problem and it's consistent. Right? If every time you get on the scale, the scale, is on one time when you step on the scale, it's on this angle of a surface, and the next time you step on the scale, it's on like a soft pad, and the next time you step on the scale, it's on a hardwood floor, right? Then you're going to get different readings. So you've got to find some form of consistency within your motion exam and the movements that you do in life to find something that is clear, consistent, predictable, and reproducible of your pain, all right? So if your problem is structurally based, like many aches and pains are, a problem with your disc or your joint or your nerve or something like that, then chances are you're going to be able to find, for example, a leg raise, maybe on the right side or the left side that's painful. Maybe when you bend your back, you're going to find that's a little stiffer painful. Maybe when you pull one knee up to the chest, or maybe you've tried some PT exercises, right, that you found on the internet, and you find, man, that figure 4 hurts so good. That's a yucky motion, and you're repeating it, right? But it is a yucky motion, so it might be valuable for assessment, right? And so you can take that yucky motion. When you do it, you can say, okay, what do I feel? And you can either get a baseline of how far, for example, the leg raise goes, right? Okay, so when I get there, I get to about 90 degrees, or when I raise my leg, I can see that mark on my wall, right? You can do something to get a baseline of your motion. You can see that motion, right? It's quantifiable. And you can get a baseline of how it feels. So how yucky does it feel when you do a certain motion? Is it low yucky? Is it moderate? Is it high? If it's low, rate it as a 10, 20, 30. The higher the number, the yuckier it is. If it's medium, rate it as a 40, 50, or 60. If it's really yucky, 70, 80, 90. All right, if it's 100 out of 100, well, you probably wouldn't be here. You'd be in the emergency room or something like that, all right? And so you can use motion. And here's the thing, it doesn't have to be some crazy self-assessment. Just take the motions that you're already aware of, right? By either doing some exercises and finding ones that don't feel good, and or just by the way you've moved your body in life and discovered things that feel yucky, right? Go ahead, quantify those things, either the motion that you're able to perform and or how yucky it feels, all right? And give it some maybe number or some way to just kind of come back to it. Write it on a napkin, write it on your refrigerator. And this is useful, right? Because then you can perform something, an exercise, an input, a treatment, hot pack, cold pack, biofreeze, whatever you're doing as an input. Consider these things or these treatments just inputs, pieces of code, if you will, that you're plugging in your body. And then because you have a baseline, because you stepped on the scale and you measured how well you could move and what that felt like, and it's something that you can see and you can feel, and only you truly know what that experience is like, not relying upon someone else to tell you, hey, you lost weight. Well, let me see the scale. Well, we can't really show you the scale, right? You want to be able to see and feel it. This is why I really value teaching people how to self-assess. And then after you do that input, yucky motion, after you perform that input and or provide that input, you feed the system, the body and the brain with that input. Then you can go and you can retest and say, hey, what happened? And there's no guessing. I did that motion, I did that thing, I did that treatment, and it worked. Or it didn't work. Or it made me worse. And this is how you can isolate the things that are helping you or not helping. You can look at each of these inputs as independent variables, run many scientific experiments and tell whether or not it's valuable. And this helps you collect data and get closer to the truth. The more data you have, the better informed the experiment. And the more you can trust the results of the experiment because you have data and context to compare it to. All right, now let's just say you're like, Charlie, I don't have motions that are consistently yucky. It's really hard to find a yucky motion that consistently reproduces my pain. One day I bend this way and it's yucky. The next day I bend that way and it's yucky. Then one day my leg raise hurts. The next day my leg raise doesn't hurt. I get it. It happens all the time. Sometimes people don't even have motions that reproduce their pain. It's actually fairly common. About 50% of the people I work with don't have a clear, reproducible, yucky motion. Or everything's yucky. Then maybe go to activity and go to function. Function is another way. If motion isn't clear and reproducible, and that's not a nice way to measure things, all right? And it's not clear and predictable, then you're gonna get kind of a faulty read, all right? Then try activity and or function. So that could be my ability to walk, for example. And here's the cool thing, it's quantifiable, right? You can measure how far you can walk or how far you can't walk. You can measure how well you sleep or how well you don't sleep, especially with all these smartwatches and things like that now, right? You can measure not only the distance of how far you walk, but how fast you walk. Probably your heart rate when you walk, right? Hey, Charlie, how do I know I'm getting better? Because my heart rate and or my heart rate variability, now we're getting a little complex, right, is less over time. It's interesting, okay? But either way, you could argue maybe that's not a perfect measure, but it might point to the fact that your body's less stressed as you're performing that activity. Right? When you're in pain, we know that increases heart rate, increases some of the other fight or flight responses within the body. So that would be an interesting measurement. And so do you see how I just came up with that on the fly? It might not be perfect, right? But you want to find some way to quantify that. Oh, like tying my shoes. Now that's a motion, right? But maybe that's how it shows up for you. And maybe that's consistently yucky, even though you can't find consistently yucky motion. Probably wouldn't happen. But your tolerance for standing. Hey, I can only get through washing 5 dishes before my back pain starts. Okay. Well, hey, can you check in once a week? And or after you perform and or try on an input, a treatment, to see now, you could just do 5. You did that thing. Now can you do 10? Average out the number of dishes that you are able to wash, right? Then go back and see same, better, or worse. And look, you don't want to split hairs here. You want to find something that clearly changes your symptoms. And ideally, if we're using a clear, consistent, and reproducible yucky motion, we find an immediate change. I want to see your yucky motions get better immediately in the moment, not weeks. All right? Not days, immediately. Yucky can't do that. We're going to do this. Better. Now, if you're saying, I think it's working, like so many people do with their treatment, I think the chiropractor is helping, I think I'm just going to keep doing what I'm doing because I feel it's working. What do you mean you feel it's working? What do you mean you think it's working? Is it working or is it not working? The light either turned on or it didn't turn on. So what are you using to measure for progress? How do you know that you're getting better? And how do you know that you're getting better? And it's not just the time versus the treatment. This is another thing, right? People say all the time, this is actually common with chiropractic care, PT too. So I'm not busting on anyone, I'm just saying, this is what I've heard. And by the way, I was trained as a PT osteopathically, also by chiros, and worked with a lot. Where it's like, I've been going to the chiro now, or the PT, or let's just make it neutral, right? Anybody, so I don't get the angry comments. And I've been going for 8 months, okay? And I think it's working. You've been going for 8 months and you think it's working? Right? And you're still going? And so how do you know that it's just not the 8 months that's making you better? And you could have been just doing nothing or been doing just general stuff. And the answer is, that's a good question. I don't. And so you could be wasting a ton of time, energy, and money doing a given treatment if you don't have a way to measure it. Now, if you came back to me and you say, Charlie, I know I'm getting better. And I know that it's the treatment, not just time. It might be hard to completely separate the two, but I know that it's a treatment because when I do this, when I did this at the start of treatment, right, day one, I immediately went in. And that day, in the moment, we did one thing, right, boom, and immediately I got better and I improved upon that, okay? And then I measured and I've been tracking that same thing. Here's the other thing. You can't change what you're measuring. If you're trying to lose weight, right, the scale is the measurement and or the metric that you go back to, right? If you're using a GPS, the mileage, right, that you're going might be the metric to tell how far you've gone, and or the direction might be the metric to tell if you're going in the right direction, right? Probably makes more sense. So if you start trying to lose weight and you step on the scale and it reads kilograms, and the next week you go to pounds, and the next week you go to grams, and the next week you go to something else, right? You're gonna be all over the place. You're gonna have to do all kinds of weird conversions and whatever. It's just not gonna be very clear, all right? And so if you, 1 week, track emotion or track your ability to do something, and then the next week you change what you're measuring and you measure something else, and the next week you change what you're doing and you're measuring something else, well, then you're going to be all over the place. You're going to have a really hard time, right, supporting the fact that this intervention that you've chosen to do is working or not working. Okay, so just something to think about. So how are you measuring progress? If you're not measuring progress, you're going to be lost and confused because number one, you can't tell if what you're doing is working, and there's no way to prove it other than I think or I feel, and guess what? I think and I feel a lot of things, and usually they're not of a lot of value, and or they're not accurate, and or they're very biased, because I can convince myself to think and or feel anything I want. I think I'm smart, but maybe I'm not, right? I think I look like this, or I think I've got a six-pack, right? Right? Do you or do you not? And so you want to have a way to measure progress. It needs to be clear, it needs to be consistent, right? It can either be in the form of motion, and or it could be in the form of activity, something you're having trouble doing. So you can measure, for example, your quality of sleep, how many times you're getting up throughout the night, right? How long you're sleeping, and maybe the metrics of your sleep. Right? There's lots of fancy things, Aura rings and other sleep tracker devices, right? That you could actually objectify these things. And that's the cool thing about technology is we can do that stuff, all right? And if you're not using it to your advantage, then again, you're kind of just shooting in the dark, all right? So just something to think. How are you tracking your progress? Are you measuring your progress or not? And if not, why? And if not, how could you do that, right? And start there. And then you can look day to day, moment to moment after you do an intervention, week to week, and say, are you headed in the right direction or are you not? And if you're not headed in the right direction, you need to find a different path, all right? I think that's it. I think that's all I've got for this video, right? A long-winded way of saying you can't manage what you don't measure, all right? Let me know your thoughts in the comment. Maybe drop in the comments, like, how are you measuring progress? Do you have a clear, consistent way, a self-assessment strategy, right? A way to monitor the metrics and or the progress that you're making or you're not making? Or are you relying upon someone else to tell you if what you're doing is working? Right? Are you driving down the road, and instead of having your own GPS, are you just stopping at random gas stations saying, so how do I get here? And they say, I think you go up here and you go there, and then you go there and you find, oh, gosh, right? Like, are you just trusting that somebody else is telling you you're headed in the right direction? Or what if you could actually define for yourself a measurement system? This is what I teach people, right? To know, without question, whether or not something's working or not working. So drop me a comment below and let me know, how are you measuring your progress objectively, not thinking or feeling, right, along your healing journey. Thanks everyone. Chat soon.